Hello, everybody. This is Armando Noah.
And my name is Louis Lawan,
We're presenting the windshield survey.
and our population base is Hispanic men in Hialeah, and the boundaries are 4 blocks between East 40th Street and East 36th Street, with the boundaries of East 1st Avenue and East 2nd Avenue. So the first social determinant of health that we saw in our neighborhood that was affecting our population was that neighborhood and their built environment. So the neighborhood, which is the current state of environment that was built around them, it plays a major role in determining an individual's ability to live a safer and healthier lifestyle. So specifically, the way an underfunded area can dramatically increase the risk to chronic diseases and many injuries. For example, while we were observing the community, there's an abundance of hazardous roads, unkept trash on the street, blocking many of the pathways, and poorly lit street lamps as well. So this shows the ability of this social determinant of health to passively restrict access to safe transportation, outdoor exercise for many of the elderly men in this area, and social interactions in the community altogether. So.
And the second social determinant of health we saw is economic stability, or we could say instability. And this limits the individual's capacity to buy or maintain their private cars, leaving them with fewer alternatives for mobility. Public transit could be reasonably prices, although it might be insufficient or non-existent in some places, especially in rural or low-income regions. This lack of transportation choices may make it more difficult for people to go to hospitals, pharmacies, or other healthcare facilities.
So the third social determinant of health that we saw in our population was the access to food. So limited access to high quality food can dramatically affect a community's health outcome. So this can passively be caused by many food deserts and food insecurities. This chosen area bordered only one supermarket that we saw, the Danos, and was surrounded by 5 other fast food restaurants. And also that we saw in our population was that the percentage of adult Hispanic men living under the poverty line is 17%. So with this in mind, individuals who consume little to no fruits as well, fruits and vegetables, will run the risk of weight gain and obesity. So with all this, this can show the ability of the social determinant of health, such as access to food, to increase the risk of chronic illnesses by restricting the population's access to much healthier alternatives.
This slide is basically about the public database information on health status, the statistics and comparison information about the community. Here's a slide I found very significant for the community. It's about alcohol and drug abuse. You can see that the overall alcohol abuse percentage is about 18% in adults. Overall, in males and 18% in females, which is about 18% for everybody. Next up, another one I found very significant for the area is the rate of community-acquired pneumonia by age. The overall, here I see, is about 14.9% or 15% of patients in this community have community-acquired pneumonia.
So key findings based on the data gathered from the Windshield survey was that our population was in economic boundaries or contained economic boundaries, such as many of the houses on that side of our population were very underfunded, while across the bridge there was more houses, such as North Miami, more houses that were better looking and aesthetically pleasing. And we also saw signs of despair in certain homes, unkept trash, broken roads, abandoned cars. And we also observed many public parks nearby, and also recreationally, there's a casino as well. And there was not common social areas per se, but there are community hangouts outside of the Sedano's parking lot and the casino, where a lot of older men like to hang out and socialize. And we also observed that there was many businesses and grocery stores that were walking distances. Walking, bicycles, bus, train, and the freebie car service we saw was many of the transportation options for this population. And the predominant speaking Spanish in this community. And there was also pharmacies and clinics in close proximity, police officers and fire departments and active around the community, and they were in close proximity. And 95% of the population in the area were Hispanic and Hispanic Latinos, and majority of the area contained of majority blue-collared workers. And Catholicism was a popular religion, most popular in the area. And there was no evidence of drug abuse, mental illness, no signs of political influence, no evidence of gang activity, graffiti, homelessness. And the environment around the area was very prosperous with plants and trees. So community strengths and health concerns is that 3 community strengths was the residents themselves, since many of the adult Hispanic men that we interviewed were actually extremely friendly and inviting, and they were open to us outsiders coming into their community. The parks and recreational centers were also another community strength, which the casino nearby was effective in decreasing mental disorders such as stress, since a lot of them socialized there. Protective services such as police and firemen were in close proximity, so this was another strength. 3 community health concerns was that broken roads, lack of access to resources, and unkept trash. A lot of these, in summary, they damage the access to transportation and outside exercises to these populations.
This is how a PHN nurse, a PHN, may use this windshield survey and community assessment in their practice. They can use it in their practice by identifying what disparities or inequalities are in the area. It could help them identify patterns and variables such as changes in socioeconomic conditions, access to healthcare, and the frequency of environmental risks such as hurricanes. During this survey, also, the PHA may shadow with neighbors and they encounter, including property owners, business owners, and officials. This engagement enables the PHN and the community to establish a relationship that fosters trust and promotes collaboration.
So potential community-based projects and organizations to collaborate with was that the Hialeah Housing Authority, which this project was has the goal of providing affordable and high-quality housing to low-income populations in Hialeah, such as our population. Hialeah Community Coalition is also another project in the area that is dedicated to reduce the occurrences of substance abuse and underage drinking, and the goal is to maintain a drug-free Hialeah community. The third potential community-based project is the City of Hialeah's Global and Human Services. Their main goal is to fund infrastructure improvements and public services, which will greatly impact and help our community by fixing the broken road concern.
All right, 3 realistic and potential community-based organizations is the Miami Bethany Community Service. They usually are dedicated to holistic empowerment of low-income individuals. The Hands of Miami, which provides many services, including yard cleaning and garden creation, and United Way Miami, which provides many services, including financial education, health programs, and more. Thank you for your time. This is the conclusion of our presentation.